Dr. Cary Adams is the Chief Executive Officer of the Union for International Cancer Control. He joins us from Geneva. Dr. Adams, welcome to the program. Are these statistics available? Are significantly more people dying from cancer during the pandemic than they were before?
Well, we certainly don't know the numbers of the extra people who are dying at this stage, but I agree with the piece you just shown about the number of treatments that have been delayed as a result of hospitals and governments giving a priority to COVID over the last 12 months. They accord with a lot of the numbers that we've been looking at. We work with WHO. We've seen that over 50% of countries are reporting disruptions in cancer treatment and care. And more importantly, the same sort of numbers about screening. So our ability to detect a cancer early, which is fundamental to successful treatment, has been compromised in the last 12 months. So we've certainly got a build-up of cancer patients. That cancer's not gone away. We've got a build-up of cancer patients that will need to be treated at some point in the near future.
Absolutely. I mean, we know that many countries have a shortage of hospital beds because of the pandemic. But are oncologists and other cancer specialists being removed from their cancer duties to treat COVID-19 patients? Is there also a shortage of actual specialists to look after cancer patients because they're dealing with the pandemic?
Well, yes, there is. And today's World Cancer Day, which is a day that we're celebrating the people, the heroes of the cancer community, have not only dealt with the cancer patients through their journey, but either have been reallocated to deal with COVID patients or indeed have voluntarily wanted to support the COVID patients through their journey as well. And we're calling them heroes, and we're celebrating today on World Cancer Day what the cancer community has done in order to address the pandemic around the world. But I think you're right. I mean, in some respects, one can understand because COVID has really overrun some of the health systems in countries, and they have tried to redeploy resource into dealing with that terrifying situation for most people. I'm from the UK, but I live in Switzerland, but we've all been affected, either friends or family, through COVID, and some of them being hospitalized. So I think we've got to be pragmatic, but at the same time, we've got to be aware and work from the data. And in our COVID recovery plans at national level, country by country, we must build in what is the appropriate catch-up for cancer and the other NCDs. We certainly know that we'll probably have an overrun of demand on, for example, pathology labs, an overrun on the requirement for essential medicines and technologies for cancer treatment and care. So we've got to prepare for it, and I think that's the key message that we're saying today.
On World Cancer Day, can I just share with the viewer something you'll know very, very well? According to the latest statistics, which date back to the years 2015 to 2017, about 40% of men and women in the world today will be diagnosed with cancer at some stage in their lives. Regarding COVID-19 and sufferers of cancer, how much more of a danger does the virus pose to someone who has cancer?
Well, I think you could probably bunch them into two areas. The first one is that we know that people with underlying health challenges who are exposed to risk factors like obesity or tobacco control develop cancer. And through cancer, if they are on chemotherapy, then their immunity is compromised in some way. So there's a possibility if they have COVID, they will have a more serious outcome, shall we say. So there's that aspect of it which is really important. But I think the second one, if I go back to what we discussed earlier, is there are a lot of people who have got signs and symptoms today who are not presenting. And I would encourage anyone who feels that they may have a cancer or they have a physical problem, which could be cancer, to talk to a doctor online or to go to their doctor and find out. And I think that's the hidden number that we don't know at the moment with regard to who is going to come through in the 6, 9, 12 months with a cancer which has moved from stage 1 to stage 2 possibly, and making it more complicated to treat.
Dr. Cary Adams, thank you so much for your time.